Dr. Tabas Kumar,
Yes, please. Is everything is ready?
we can.
Should we start?
Yeah. Yes, please. We can start the program.
Okay, thank you. A very good afternoon to all of you. I welcome you all to the national webinar on COVID-19 child, early and forced marriages, jointly organized by MP Institute of Social Science Research Ujjain and Child Centric Disaster Risk Reduction Center, National Institute of Disaster Management, New Delhi. In this webinar, we have blessings from our respected patrons, Major General Manoj Kumar Bindalji, Executive Director, NIDM, New Delhi, mentors of this program, Professor Santosh Kumar, Professor of CCDRR Center, National Institute of Disaster Management, New Delhi, Professor Yatindra Singh Sisodia, Director, Madhya Pradesh Institute of Social Science Research, co-convener of this webinar, Dr. Kumar Raga, coordinator of this webinar, Dr. Balu, and eminent speakers of this webinar, Mr. Sonikuti George, Child Protection Specialist, UNICEF, and Professor C. Venkatachalam, former head of the Department of Sociology, Periyar University. I warmly welcome all of you, sir, to this webinar. This webinar has been conceptualized by Child Centric Disaster Risk Reduction Center, NIDM, and MPI SSR Ujjain to unfold the impact of COVID-19 outbreak on children. As all of us know that children are the most voiceless section of Indian society. In this crucial time of COVID-19, the children have been dragged into the economic and social constraint faced by their parents. Media reports confirm that child and forced marriages have been increased during this time of COVID-19. The problem is indeed very crucial to ensure protection and safety of the children in our society. However, we are pleased that all of us have joined in this webinar for analyzing the inherent causes of early and forced marriages during this pandemic and how to check and prevent this social problem in this crucial time. Friends, we have two eminent speakers with us to throw light upon the root of the problem, and offer possible solution to overcome the problem of early and forced marriages in this time of COVID-19. I warmly welcome all the resource persons and participants to this webinar. Now I hand over the session to Dr. Balu to carry forward the proceeding of the webinar. Dr. Balu.
Yeah, thank you, Dr. Tabas, for providing a warm welcome to all of us. First, I would like to give a brief about the objective of this program. And we all know that this COVID-19 is an unprecedented situation. Though the children are not face of the COVID-19, but of course, it has a huge impact on the life cycle of the children, and especially with education and health, and there are various impact on the life of your children. And here we are going to discuss about the children's early marriages and forced marriage, and how it is being impacted on the life of the children. And we also going to discuss certain measures to address these child marriages. Basically, of COVID-19 and lockdown period, this number of child marriages are being increased all over the country. So the reason, if you see, the entire society's concentration was on COVID-19, and in this situation, the people, the family members, they were doing child marriages and also forced marriages. And the reason, if you see that, one is expenditure reduced, less expenditure, so it's also a chance for the families to go for a child marriage or early marriage. And another thing, many families, they have their employment opportunity and income also has been reduced. So due to various reasons, these child marriages were also being increased. So now here we are to discuss the reasons and also how we are going to overcome those issues. How these child marriages and early marriages were impacted on the life cycle. So with brief introduction, now I to invite our speaker, Mr. Sonikuti Charles. It is my also pleasure to introduce our speaker to all of you. Mr. Sonikuti Charles is the Child Protection Specialist in the Hyderabad Field Office of UNICEF for years. Prior to this, he worked with Child Protection Specialist in UNICEF Delhi office for 5 years. And Mr. Sonikuti has extensive experience in the field of child rights. He worked extensively on child protection issues, child labor, child trafficking, juvenile justice, and children in different circumstances. He was part of the drafting committee of the Juvenile Central Model Rules and the Integral Child Action Scheme for the Government of India. He is linked to the major child rights initiatives of the country through the various networks and alliances. He has been actively working with the Supreme Court Committee on Justice, many of the high courts. Sonikuti collaborated with NIC on pioneering work on missing children brought the police. NIC has to share data. Before joining UNICEF, Mr. Soni was working with the Plan International in Bangalore as an education specialist and was involved in teacher training and quality.
Sir, Balu, now technical problem. Balu is not able to.
Balu is not audible.
Balu is not audible.
Okay, can you hear me, sir? Hello,
Tapasji, आप
Tabasji, can you hear me? I'm Sony here.
Yeah. I am hearing you, sir.
Yeah, okay. I think I will proceed with the presentation as we have lost Dr. Balu.
Okay, sir, no problem.
Yeah, thank you so much for the good words and the great opportunity to be part of this, I must say, a very special initiative from indicator of the extent of an issue. So we see that the numbers have increased in May, June, July. What the minister itself has said that the department itself is stopped a certain number of child marriages. And we have UNICEF's own partners. We've got additional information which is not included in these database. And we see that Tamil Nadu, Karnataka, West Bengal, Andhra Pradesh, and Telangana are top 5 states that have reported most cases of child marriages. Now, this is an interesting factor. These are not the states known for the high burden of child marriage in the country. But we see that possibly because of the effectiveness of child line and interventions that is happening in these states, we have much higher number of reported cases which is coming up here. Now, let us really look at the challenges. I mean, what is it that is increased all these? As I said earlier, the closure of schools, the economic hardships, tracking of child marriage cases, disruption of protection services, and reduction in the cost of marriage dowry. I think Dr. Tabas and Dr. Balu was actually talking about these things, which has actually increased the chances of child marriage. Now, it is not just the increased chance. We have evidence from the field that shows that there has been an increase. So this is what is happening. And now, in this scenario, what do we really see as being the interventions? Now, actually, whenever we see the context when we are looking at interventions, I think we need to look at the challenges first. The most important challenge is the most vulnerable children have been the ones most out of reach. Now, out of reach, I would say, because of the internet connectivity issues, you are not on the social media, you are not visible, people are not able to go to tribal areas, people are not able to go to the rural areas. And there have been issues of reaching out to the most vulnerable, the children who went back from childcare institutions, the children who went back from hostels. They are the most vulnerable and the most out of reach. The second is the extensive reliance on digital communication. If you actually, the face-to-face, one-to-one interactions have not been happening to change behavior. So we are left with a situation which is actually turned the table around and telling us, like, we need to be more at the field level, but then there is a limitation. And also compounded by all this is the compounded by the funding cuts. Even WCD itself had to go through a 15% reduction in its budget, and the child protection work and work on child marriages and others have therefore been affected. And resource mobilization is itself becoming a difficult issue. And I think it's like, I think one great thing that happened in COVID times, because it was a different kind of a pandemic which the world never faced. And even what we are as NIDM and child-centered disaster risk reduction cell is talking about child protection, and child marriage is a clear example that we are moving into a realm where a lot of these child protection interventions are becoming the first respondent group. That means it's becoming an important dimension of response in terms of child protection, and need to look at issues of mental health and protection services for children. And I think this is a very good and positive change that we are seeing. And I think the whole issue of reach versus quality, I mean, like, as we said, in the challenges of digital and how do we reach out with communication changes to individually change people, look at that is going to be a challenge. And what are the opportunities? Like, I think the whole lot of issues of migrants and the need for psychosocial support and domestic violence and issues like child marriage have received a certain amount of visibility. I think the kind of reporting on COVID and how we have seen this, there has been an increased visibility. And there is the potential of family-based alternative care and of collectively working together. Now, what we really need to look at is, like, when we are trying to intervene, what are the areas? We see that we need to be strengthening the system. Strengthening the system of ending violence and psychosocial support. I think I'll go into details on each of these. And strengthen the system of alternative care, where we're looking at the family. We have got children from institutions back into families. How do we really strengthen that system? And how do we really look at child labor and children on the move as a focused area? And how do we really look at the last area of ending child marriage and adolescent and youth empowerment? How do we really build on the agency of adolescents? Like, how do we build a Tanzania who can actually reach out to a child line and able to challenge the situation? And we really need to create the evidence. We need to create the partnerships and make the child protection systems. So if you really look at a good practice in systems, like, Childline, I've mentioned a lot. We have said that Childline is a possible partner in this kind of an intervention because that is the first and emergency outreach program available to us. We have the police. I think one segment which needs a lot more of collaboration by NIDM and others is the role of police in child protection. We have the SJPUs, we have the system which is there. How do we really use the police in really behavior change communication? How do we really use the Railway Protection Force, RPF, for example, in working on trafficking issues and at railway stations and work this one? We're doing it in Bihar, in Bangalore, in West Bengal. There are a lot of these things which are emerging as possibilities. And psychosocial support and the possible work with NIMHANS are not going to be, we have all experienced that more than anybody else, the necessity to work on this. And I think the second area is how do we really look at strengthening the families? And as I said, we have had the experience of like over 85% of children in most of the states from childcare institutions, all hostels, backward hostels, all the tribal welfare hostels, everything has been closed. A lot of children have gone back home. And that is a potential area which can actually increase the risk of child marriage and the whole challenge there. The third area is how do we really look at child marriage and child labor and children on move? Like, the children on move is basically a big challenge, because what happened is, like, we have seen a whole lot of children who were in various parts of the country had come back to the village. And this is a scenario where most of them have not gone back. Some of them have started to go back. But the availability of such children is going to be a potential for an increase in this one. So how do we track what is happening there? How do we really look at the young people themselves as change agent is pretty critical. Now, in terms of ending child marriage, I'm just looking at some of the experiences, like nationally. We have the UNFPA, UNICEF, and a whole lot of partners who are working on this issue. I think one of the key areas has been, like, you've been able to leverage the district administration plans in most of the states. Some of them are listed here in terms of bringing the resources for child action on child marriage. This, I think, is something which the DRR work and how we need to be collaborating on disaster, because there is the money that is available needs to be converged to bring these tangible changes. And we really need to look at advocacy and the communication methods which is available to us. And there is everybody who is, like, preparing these materials. And I think the kind of way forward is to use these kind of advocacy and behavior change communication package. There is the potential and possibility that there is the materials which is developed by UNICEF on the advocacy on behavior change, and there are a whole lot of audio visuals available which can be shared, and we can use it on this fight. And actually, what is it that we need to look at the priority for state action, and how do we really move forward? I'm saying that we have the availability of certain materials which are developed on child marriage. There is the key to it is going to be the work on behavior change. And second is how do we work on the basic power of the adolescents themselves, organized power of the adolescents. How do they get the agency, the courage to call a child line and seek help? And once that is done, we need to establish plans to strengthen district and sub-district workforce. Now, this is basically the challenge before us is, like, how do we make the CMPOs, the child marriage provision officers under the Act who have been designated, to be more functional? How do we really look at the child protection workers, the DCPOs, and everybody at the district and sub-district level who are engaged in child protection to work on the functionality? This is the first priority. The second is how to bring in the child protection management information system, the knowledge, the data. And basically, how do we really work on this? Right now, the available data on child marriage is possibly the reports from WCD and from Childline. We do not have any data on, there is in the health system not even one birth which is registered as a child who is below 18. So how do we look at a health system naturally generating child marriage and the impact? How do we really have the police system generate a certain amount of data? And this becomes a critical set of action. The third is like, how do we really push end violence against children, the EVAC agenda? How do we really agree on ending violence, that child marriage is a violence? It's not just physical violence, it's just not sexual offenses. Child marriage is a violence and we really need to act on it. And therefore, how do we really get that contextualized agenda, which looking at high priority districts, looking at districts which has got more inclination, and looking at available data and using those to really strategize at the context. And mental health support systems, and how do we really increase the coping mechanism for people to look at this, is going to be the other area. And I think the whole thing about strengthening family and using sponsorship and social protection and cash plus elements into our social protection programs. How do we really reach out to children who have been reintegrated with families, who have been from hostels and within families? How do we really make sure they continue their education? How do we make sure that there is a linkage between our social protection programs and this? So that is going to be a critic area. And I think we need to be ensuring COVID sensitive district implementation of end child marriage and adolescent empowerment programs. Because there needs to be a very focused district convergent action, which we need to be looking at. Now, when we look at why do we really need all these things? India accounts for 1 in 3 of all child brides in the world. Now, that is a startling position. If you don't deal with it, we have an issue. And in order to meet a SDG target of elimination of child marriage by 2030, how have we doing in the last 20 years? In the last 25 years is in the dark blue, in the light blue is what is observed in the past 10 years, the kind of percentage reduction which is happening. Percentage reduction is, it's like, from 3.2 to 5.5. We are nowhere near reaching the target right now, unless we have an accelerated and much more focused action, which really brings us there. Now, where is this problem more? It is the issues educational, the educational quadrant. The first one shows that, from no education to actually where there is some education. If there is no education, you see that married by 15 is in dark blue and light blue is the marriage 15 to 15 plus, 15 to 18. So before 18. So you will see that the numbers, no education, 51% if not educated, and primary education. So we see that around 50% is actually no education or primary education. So that is a segment which requires a lot more of attention. What has COVID done to these people? We know they are the migrant laborers, they are those people who are out there. We have pushed them further into poverty. So this is one segment which really deserves a whole lot more of attention, that client. And in the wealth quantile, the poorest, the 46% and the poorer ones 37. So you see that around 45% of people who are in that category right now, who became visible, who had migrated, who were not visible, is giving us a segment which requires focused action. And I think the rural-urban divide is also equally important, that we really need to be focusing a lot more on these rural areas, which means like we have to get down to more district-level strategies and working on these issues. And this gives us the necessity to have the focus on certain set of people. And you will see that education, no education, the access to social media, the access to internet, the access to all our mechanisms to reach right now would be lesser for these kind of people. So these groups which we are talking about. So we really need to be having a strategy which will be able to reach out to them. And what is it when we really converge and do? Who should be? As I said, increased poverty, dropout, distress, institutionalization, violence, and negative coping mechanism. Who should actually do this work? So we need the whole dimension of social protection. The social protection, because if you're looking at people getting pushed into the poorer category, the poor wealth-wise, we've seen that is one segment needs to be reached out with cash plus and additional requirements. How is our MREGA working? How is it like, how are we able to reach out to them with social protection is going to be the first challenge. The second is on dropouts education, because dropout is again directly linked to child marriage. What happens to child marriage? Out of school, we saw that education, if it is only at primary, secondary level, if you drop out, the chances of child marriage is much higher. Therefore, we need to work with education and this. The whole element of health, which is not being seen as actually part of work on child marriage. I think basically the work we need to be doing with health is in terms of the high burden of child mortality, children themselves bearing children, is to be seen as maternal mortality and child mortality has a lot of link with the age of the mother. So how do we really bring in the work, the coordination with these people is important. I think what is already been discussed is that we need to be working for communication for development or behavior change communication. Now, how do we really get to that segment of people and what is the modality and mechanism to reach that? How do we really look at the advocacy to increase the cash and support systems to these vulnerable groups? And I think the single platform which can bring this together is the disaster risk reduction program. Because when we look at increasing vulnerabilities and the risk reduction in terms of the positioning of NIDM and DRR work under the chief secretaries in most of the states brings in the potential and possibility to converge on this realm of work. And therefore, I see it all the more relevant that we are discussing these issues in the context of disaster risk reduction and the role of NIDM in being that central convening body which already is working with all these stakeholders, and how do we bring it into focus is the way forward. And I think we really need to look at this in terms of education. How do we really look at the prevention at school dropout rate? How do we look at the disaster preparedness in terms of how do we really look at the school safety programs? Actually, this is one area where the DRR and IDM has been working extensively, the school safety program. And that gives us an additional opportunity to look at other issues of child dropout and other imminent dangers to childhood which is happening there. And how do we really look at the psychosocial support, the kind of school health program linkage to the whole issue of child marriage? How do we really build those issues, build that into the health work and health realm? How do we really expand the social protection schemes and sponsorship into reaching it to the most vulnerable? We said, uneducated people who are there. How do we really focus and target them? Building evidence. How do we really create that evidence? These impacts of social poverty on these indicators. How do we really look at monitoring and advocacy for public finance for children? I think it's it's a DRR approach to child protection is a much more meaningful approach for resource generation and resourcing for children than any other. And I think the whole advocate for child protection in emergency, I think the child protection in emergencies, we are moving there. And I think this is, I'm extremely happy that we are looking at it together with NIDM today, the issues of child protection. And that is something which is the potential of moving forward. How do we mobilize the community structures, the end child marriage and violence against children the whole community structures. How do we really get down to sub-district level, village level? How do we look at data, and how do we really move forward? And actually, there is a Tarunya toolkit on child protection functionaries, on behavior change communication, how we can really use it under the DRR umbrella to really reach to this one. And I think we need to be looking at evidence and campaign on ending violence on children, because every child matters and no child is for sale. And we really need to bring our strength together and bring our youngsters together to fight this by themselves. We need to champion the cause, build the systems, and empower people who are there by working with them. And right now, I very strongly believe the NIDM and the disaster plan, because of the exacerbation of the factors of child protection, because of COVID and because of any emergency, brings this as a focal point of action for disaster risk reduction. And actually, the child-centered CCDRR program, a big congratulations to you on initiating this, and all the very best, and thank you so much. Yes. I think
for in the entire aspects of which we have talked about factors facilitating for child marriage, and also shared some of the good practices and priority area for intervention, and some of the priority area for convergence, which have been discussed by you. And we also working on some of the areas. And especially I have also seen in the villages specifically how this number of child marriages were being increased. For example, because of these school closures, now the child marriages were increased. Now I was regularly watching this WhatsApp status and all. If I see the school going children, 11th standard and 12th standard children, every day I could see a new status. Every day some children were getting married at the earliest age. And when the mothers and the family's perspective is the child marriage, they are seeing as a coping mechanism, and the mother is seeing as a like safety and security for their children. In that case, how we will see this, or how we can how we can convince the mothers to stop or postpone such early marriages? The mother is seeing this as a safety and security mechanism for their girl children. So what would you say? Means them, or how we can arrest this in?
Thank you, Dr. Balu. I see from my experience of working in the field, the pressure on the parents can actually be brought by students or fellow children themselves. Like whenever we have seen that there is a collective, the peer group which is working together, when there are children's collectives or any platform which is available for children, the whole group moves to the parents, and I've seen many of them, they use school teachers and other influential people from panchayat and other ways to use this one. And this I've been actually watching as an effective mechanism. Now, the first case study which I brought to you is like we've not been able to stop the marriage, but you will see that some have actually got back to childline or other situations when child marriage is already happened. But the one is intervening and putting pressure at that level. The second is also the social protection mechanisms. Like, can I actually, when a parent is trying to get a child marriage, can the system, can the panchayat say, like, we will ensure that she studies, and this is the required cost for studies will be borne by the panchayat, or whatever a decentralized mechanism of reaching out to families. Right now, our schemes are at a much higher level, at the state level. It is not the panchayat level. If there is a devolution of power which happens, and the finances which happens to deal with some of these issues, which maybe not be very huge in amount, mostly it can be and a flexible amount which might be available at the panchayat level to make sure those interventions happen, I think this would become meaningful. So from my experience, it is early warning, use of peer groups, use of school and panchayat system, and support systems like sponsorship or continuing education support that really stops the process. Yeah, by the way, Dr. Balu, we have also used the police effectively in some places. For example, we have a lot of states where we have a lot of programming with police, and just a visit by the police to the you don't need to use anything. You know, just there being asking some questions. Are the children going to school? Are things all right? That makes a lot of difference. And I think we actually we have not used the power of the uniform effectively as child friends of children and on child protection. I think they have a vital role to play, and we need to capitalize on that, which I had actually earlier mentioned in my presentation on work with police. But when we looked at the collaborating agency, I did not, oversight, but I think we really need to look at the role of the police also. Thank you, Dr. Pal.
I think let us move to the next presentation. Maybe end of the session also we can have some question and answer. If I receive a question from the participant side, I'll give it to you, sir. So
yeah, anybody, if they are putting on the chat box, I will pick up the questions also. Like, yeah, please. Thank you so much, Dr. Balu. Yeah.
Yeah. Thank you. To invite Professor Venkatachalam. He was a former professor and head Department of Sociology, Periyar University, Tamil Nadu, and he has done his PhD in 1984, actually before I born. And he was also a founder and professor and head. He specialized in industrial sociology, sociology of childhood, social genetology. And he established the social laboratory at Periyar University to study the problems which have social ramifications by adapting cumulative efforts. And he's also a founder coordinator of Center for Village Adaptation Scheme at Periyar University to learn the village by intensive field work on multidimensional social issues. And he's also a founder for Young Child Scientist Award to the children belongs to the village to impart scientific temper in the young minds. Every year on 28th February, National Science Day, the children scientists recognized at this university. And he's also a founder coordinator for Equal Opportunity Cell to bring the peace in the campus without deviating the caste, color, or grade. And it's also a resource person for preparing the Human Development Report funded by UNDP and perspective plans for district funded by Tamil Nadu Planning Commission. And he successfully guided more than 12 students for completion of PhD. And various students are also done PDF under him. And 59 students have been completed MPhil. And he almost published 2 books and 63 scientific papers and more than 200 papers presented in the conference. And he organized international national level seminars. There are questions before this. Mr. Sonikuti, sir, before the session. You are muted, sir.
Okay, I think the questions are on 2 things. What is the psychological strategy, and also the age at marriage. I think I'm not going to comment on the age at marriage because it's already something that is being discussed and legal reform is being thought about, and therefore the age at marriage for girls being made 21 is being thought of. But when we read the situation of what is happening in the country vis-a-vis protection of children from sexual offences, POCSO Act, and the experimental sex which happens at the age of 17, 18, and what is happening, that one of the areas which I said is in terms of not just forced marriages, there are self-initiated marriages where children themselves fall in love and this one. So a lot of the age at 18, where consensual sex is not agreed even till 18. So what is happening is the pressure on the police system, the pressure on the system on that is something which needs to be simultaneously considered. If you are looking at and the punishment is not low. Elopement, a boy who is above 18 and eloped with a girl, and even though it is consensual and moved below 18, you get imprisonment up to 7 years, and it's not like, so it's no more a joke. It's no more. So there needs to be a discussion and debate on that when we are dealing with the age of marriage. And I'm sure Professor Venkatachalam will certainly deal with that dimension when he is talking about, because that's something which is of current relevance and this one from us. And I think the psychological strategy is to basically, how do we promote champions? People who withstand child marriage pressure. How do we give ideals of children who have done that at the community level as champions? This has worked effectively in many states. There are people who have done that coming up to the president level, this one. So it actually gives a media coverage, and also gives to every girl who wants to fight child marriage, gets them a boost and gives them a lot more of psychological pressure. And I think that is the collectivization and improving the agency of adolescents, like building on the agency of adolescents and giving recognition to people who have effectively dealt with, would be seen as a psychological strategy of to prevent child marriage. Thank you so much, Dr. Balu. Yeah, I'm done, Dr. Balu. I think we can't hear you. I think Professor Venkatachala, you might, yeah, Dr. Tapas will.
Yeah. I think we have once again lost Dr. Balu. Friends, now it is time for presentation by Professor C. Venkatachalam. And now I request Professor Venkatachalam for his presentation.
Very good afternoon to one and all. It gives me immense pleasure to associate myself this evening to discuss about the child early marriages. And at our outset, my heartfelt and sincere thanks to go to the Dr. Balu and the entire team belongs to National Institute of Disaster Management and other responsible several organizations joined together. And I sincerely my thanks to one and all for organizing the important meeting to discuss about the important issues. When Bala approached me to associate myself with this program, I immediately agreed since my PhD thesis long ago in 1990, I have done the research on child labor. Later on, I was the member of the Child Welfare Committee in Tamil Nadu. Then I have done a lot of research on the child rearing practices in dual carrier families and the children conflict law. There was research being conducted by me in Tamil Nadu. Then I prepared the human development report funded by UNDP. And similarly, we did some kind of research on the street children. And again, there is the impact of migration on the children, migration of the families on the impact of the children. Several research. So I thought this is a time to discuss and deliberate and participate in this event. All of us know very well we are discussing about during the COVID-19 what is happening to the childhood. All of us know very well since childhood is a very important dimensions among the human lifespan. childhood is playing a vital role. Since this particular duration of child requires a lot of care, affection, involvement from parents and the primary group. Lot of research studies, not only in India, abroad, psychologists, sociologists, political scientists, public administration experts, and many people have done the research. We could understand that the earlier speaker, Dr. Kuti, has spoken about the role of family very well. And long ago, social psychologist C.H. Cooley from American Chicago School of Social Thought, he has spoken about the role of primary groups, how this role is playing a vital role besides the parents. The child who is being considered as equal to a small sapling. Sapling also needs enough sunlight, shadow, and water. And if any one of these things less or more, the sapling will be grow with the plant. Similarly, childhood is very, very important place. Child rearing is an Herculean task since the childhood consists of a lot of innocence, curiosity, and interest in learning. When the innocence disappears, learning too diminished. So, child is a learning process through the. Realizing the importance, the Chinese proverb rightly points out that ruling the nation is easier than bringing up the child. The importance of childhood, since India is the dubious distinction, or we can say that demographic dividend. We have more number of children, even more number of children than China. So in this context, we are going to have a more number of producers in the years to come. We are going to have more number of labor force and all. If the childhood is looking into properly, we are going to have. The rights of the child, UNICEF brings the 4 rights as a child in the year 1989, which is being considered as an important milestone in the children are concerned. Through the program of action in the year 1902, the implementation of process have been initiated. The 4 rights are nature rights. They are very much needed to every child. Yes, survival rights, development rights, participation rights, and protection rights. Sex ratio and the survival rights. In India, child sex ratio number of females per 1,000 males in the age group of 6 to 6 years. Currently, there are more boys than the girls. Even sex ratio also, general sex ratio also speak the same. An imbalance in this group will extend the older age group in future years. In ASEAN culture, families want baby boys because it is a traditional that boys take care of parents while the daughters marry and leave the family. These families want to ensure elderly security, therefore, more boys in the family. Long ago, 2001, along with from USA, we organized a program. That program is being called as the Sun Preference, and the program is organized because of want to establish what type of sex ratio is, because it's a gender preference country in a one sense. The developmental rights, multi-dimensional development of the child on the basis of socialization process. This is sociology is very much emphasizing on the socialization process, how it is stabilizing the personalities within the family. There are different stages to be understood in the child rearing practices. A child needs not only acceptance, but he should learn with what is ridiculed to. He or she has to be taught with the happiness and sorrow. Long ago, there is a magazine called Mirror. When I was doing my research, there is a dichotomy. The child is not only acceptance, the child is not only happiness, but the child also has to understand what are the other side also, because when the child become adult, he has to understand what type of things the society is expecting from the child. The participation rights are concerned, because we are talking about the child marriage. Child marriage incorporated, there are several things. There is a child labor, there is a children at risk, the juvenile delinquency, child abuse. A lot of issues are there. Because when we are talking about the child marriage, other problems of the child also join in together. Children are participating in the labor activities to earn income. This is across the country. There are various states, various districts. You can find number of children are working. No, They should be along with the our children, but they are living with the adult world. No one knows how many children. Yeah, because definitions are different. UNICEF is giving a different type of numbers. ORG group, Operations Research Group, is giving different type of numbers, and the concerned state is giving different type of. Government also giving different type of numbers about the children. But there are differences between child labor and child work. This is a Gandhian economist rightly points out that work during the childhood is a national good and a social gain. Child labor is a national evil and a social waste. This is the context about the child. We never bother about the when the child is working along with the parents and the elders learning new skills. There is a child work. But the child labor is the child is neglecting the studies, child is neglecting the recreation, child is neglecting the entire family, and the child is because his child become the child labor is a national evil and social waste is classified. Coming to the protection rights, family members and the primary groups have to play a vital roles in the imparting the knowledge, norms, values, customs, traditions in the young minds. The formal institutions come to next level to take care of the children, like in the social welfare department, police department, and many other organizations. Many stakeholders are coming to picture to play a vital role in the protection of the children. The parents themselves in arranging the child marriages. We know very well the formal agencies in some of the districts in Tamil Nadu and many other states. The district collector himself is giving the numbers to the wherever the possibilities of the child marriages, and the government mechanism, government machinery try to stop the child marriages, but the parents are very much interested in child marriage involve underage women, many of who are in the poor socioeconomic, because we should not confine to only with the poor socioeconomic conditions. That means we are not doing a lot of research on these things, because when we talk about the child inequality index, which is related to the human development index level, we can understand that poor socioeconomic conditions is one of the factors, but it's not only factor. When we talk about the child labor too, we understand that poverty alone is not the cause. Other causes also join together. The parental apathy towards education, the children is not interested with one of the famous study conducted by Main Weiner, who have come from Massachusetts Institute of Technology, a political scientist in USA. He made a study in 1991 itself. His book is known as the State and Child in India, where we are using the different type of variables, but use the variables, school variables. The school with the facilities, infrastructure facilities, how the schools are attractive places. When the schools are not attractive, when the children are not interested to go to schools, they want to stay back in the home. Even we have adopted the villages with several places. We find that even where the children are, because until ninth standard, the children will be classed. There is no stagnation, there is no dropouts, but children will be promoted. What is happening? Children never come to the schools, and the children stay back in the homes. Even parents are encouraging the things. What happens? These things, the children go for the marriages, child marriages, because the parent they want to without informing these things. But sometimes the child is contacting the district administration. My parents are going to arrange a marriage for me. The International Center on Research on Women UNICEF publications have estimated that India's child marriage rate to be 47 from sample survey of 20, while the United States reports is to be 30% in 2005. The rural rates of the child marriage were 3 times higher than the urban India rates. This is quite natural because there is a rural urban divide. It always is there, not only for the child marriages, but even the rural areas. We cannot classify the only rural and urban, but some of the villages are very far away from the urban centers. Some of the villages are far away from the urban highways, because remote villages, the possibilities are there. One observation we made in one of the backward districts in Tamil Nadu, because the families are migrating neighboring districts, neighboring states like Bangalore and Kerala and all. They will come back only after a few months, 3 to 4 months. They will stay back. what they will, because they need protecting the girl child. So what they will do, they will go for the child marriage because they feel that it is safe. So we cannot understand only from the single point of view that this is only because of poverty. But there is no poverty at all because they are lavish. They are bringing the money. They spend lavishly, but they think that early marriages there is some plus points are there because they want to go for the child marriage. It is happening in, even we are continuously we are doing the research on these child marriages in wherever the chances are there. Once upon a time, we find the female infanticides are more because now the things have been because of advocacy, because of awareness creation, because of lot of field work components and all. These things have been reduced. Several states of India have been introducing incentives to delay the marriages. Haryana introduced a My Daughter, My Wealth program in 1994. It is conditional cash transfer program dedicated to delaying the young marriages by providing a government paid bond in her name payable to her parents in the amount of rupees 25,000 after her 18th birthday if she is not married. These are some of the practices being done, but this is alone is not, we cannot solve the problem because it is the things we can understand that the basic reality, what is happening in the rural areas, we can understand that this is a make a future India because India is occupies a lowest position in terms of human development index is concerned. The reason behind is because there are several parameters we are using. One parameter is a child inequality index, which consists of negative as well as positive. When the children are more number of children are going to schools, it is a positive. When more number of children are dropouts or there is no transition, it is a negative. And the children, the child infant mortality, under 5 mortality and all, this is joined together these things. But all the cases you can find instead of boys, the girls are worst affected. Just these things are being practiced. Dowry is a practice in India where bride's family transfer wealth to groom because this is one of the system is there. In many cases, it is a demand and condition marriage from the groom's family. This is system the girl's family at the tender age itself. They would like to fix the marriage to avoid the dowry if the girl child is well educated. Even know very well most of the school final examinations and the children involved in the scoring more marks and all is favor for the girls. But instead of all the things, what is happening is child marriages can prevent. Child marriage can prevent the family from pushing to the problem of the girls who marry early in life are less likely to inform about the reproductive issues, and because of this, pregnancy-related deaths are known to be leading cause for mortality among the married girls between 15 and 19 years of age. We know very well this is not a psychological, this is not a biological cause. It is a social cause. Social cause is because the parents are unaware. The parents is aware can be identify that this is because of literacy level of the parents, the resources available to them, but they never understood that the pregnancy deaths are related to the young and child marriage. These girls twice more likely to die childbirth than the girls between 20 and 24 years of age. These statistics, we have to take into these things to the wherever possibilities for the child marriages are there. Even you talk about the during the because of closure of the schools and more likely to the parent, this is the problems in the families, and also all the things are joined together with the poverty. So these things are and the culture of the areas and the culture of the family join together push the children into the girl children particularly into the trouble. Girls younger than 50 years of age and 5 times more likely to die in the childhood because these to be addressed properly, and because even though some changes are taking place, we cannot say, we cannot deny because of lot of the field or components have been emphasized, and these things to be further look into. Infants born to mothers under the age of 18 are, and are 60 more likely to die in the age of first year than to the mothers over the age of 19. we can understand that if the children, they are more likely to suffer from low birth weight, malnutrition, physical and cognitive development. This to be understood in terms of health is concerned. The parental apathy towards the girls' education particularly, but they are unaware of what are the malnutrition. The UNICEF rightly points out that malnutrition and undernutrition, this is the invisible hunger. The children will take the enough food. One of the studies we conducted in the comparative study in rural, urban, and these things, rural, urban in tribal settings in Salem district of Tamil Nadu, we find that wherever the poor families are, irrespective of the rural, urban, and tribal settings, this is happening. Malnutrition is very much visible because, in spite of there are several programs, referral programs are going, but these things still happening because this to be understood properly. Young girls in the child marriage are more likely to experience domestic violence in their marriages as opposed to older women. This is the methodological issues are coming to picture because when you are going for the simply child marriage, go through some statistics analysis and all these things we cannot understand because we need more and more number of qualitative research. We have to make a case studies, observation, narratives, focus group interview. Then only we can understand child marriage. We can understand that when the government machinery is trying to stop the child marriage, but the parents, the villages, and the peoples, so they want to go for the child marriage. We can understand that the culture is being intervened because the culturally they are very strong. They want to go for the child marriage because it is the things are deep rooted in their mindset. So these things simply throw we can that emphasize alone, advocacy alone will not play a role. But we can understand that what is a nexus between why they are going for the child marriage, in spite of their health issues are involved. The children, there are possibilities for die at the early age. That a study conducted in India by International Center for Research on Women showed that girls' marriage before 18 years of age twice as likely to be beaten, slapped, or threatened by their husbands, and 3 times more likely to experience sexual violence. We can understand that this is a things are because it is these things happening in many parts of the place because when the child is unknown, when the child is, cannot understand what is the family issues, because family sociologist we can understand that how these children are being and they do not know how to make it the family because some certain ages are required to understand what is the importance of the family, how to child. When the child become the mother during the childhood, we can understand then what type of things she can carry before realizing the things she will become mother for 2 or 3 children. Young brides are often show symptoms of sexual abuse and post-traumatic stress that we know very well as a understand certain level, but these things to be addressed properly to avoid issues. So overall, we are talking about the during the COVID-19 period, but these some of the fact-finding research and the reports collected by our students and those who are making the field visits and all, because we have been asked to make a perspective plan for certain districts, villages, hamlets, panchayat villages. We understood that, realized that these things are, we have to realize that when the children have been forced to stay in the families during the COVID-19, they realized that these are the things are, they want to go for child marriage because during the COVID-19, the families have been stayed in the villages without income generation activities for several things because this is a thing not that they have to go for migration once again for a short-term migration, long-term migration, and the migration for a particular period. They would like to go for the marriage because these things are unnoticed by the many scholars because since we are the active field workers, we could understand that These things are happening in many parts of the villages where we have make a study, because we usually make research on the villages by going wherever the low socioeconomic status, low level of literacy, low level of employment chances, and wherever possibilities are not for the development of the industry, certain villages we have adopted, and we are closely watching on these things. But we could understand that the methodological issues are very, very crucial point to bring out the hidden facts. What are the hidden facts? The possibilities for we got to make thorough case studies, close observation, and make a narratives. And these things we can identify, make some content analysis to avoid, because after the child marriages, studying them, what are the issues are taking place in the body of the girl child, and what are the trauma is taking place, what are the issues are available to the girl child. There is no issue at all. But the things in preventing machinery mechanism is very, very important, which can play a vital role by using methodological issues to be adopted very carefully. And bottom to top approach model to be strengthened, because we are generally we are going for the top to bottom approach. But my emphasis on bottom to top approach, not only by the district level, even each and every hamlet is unique. There are several programs are going on. Government machinery has introducing several programs to avoid the child marriages. But the problem is because several stakeholders are there. Various organizations are ready. But as a social scientist, we got to channelize what are the villages depending upon the need, depending upon the chances are available to them. We got to bring them together to make the child marriages we can stop, and make the child is a vibrant, and the child is a very unique, meaningful citizen to the family. And because we can bring the all the things together, and we can avoid the child marriages. So second, emphasis on bottom to top approach from each and every village level, hamlet, panchayat level, and put together, bring under the block development officer, and make it the various stakeholders like a non-governmental organization, community-based organization, trust, and other organizations. If we make a meaningful analysis, we can find what are the variables are playing a vital role, as the poverty, the ignorance of the parents, and the children's interest towards the studies. And we can bring the school teachers and the headmasters also, we can put together and make a meaningful analysis through bottom to top approach. Otherwise, we can read out the statistics, we can compare the model from one, because each village has, they have to prepare own model to avoid child. Otherwise, we cannot make it the child marriages, we cannot stop it in the days to come. The child inequality index is keeping the down the country status, the HDI at the world level. India is occupying the 2019 129th rank in child inequality index is concerned. But when you go for the things, we are preparing the way forward approach. What type of way forward approach is being the things? Because there is not only one aspect. Child labor, which leads to child marriage, feed child, which leads to child marriage, children abuses, which leads to child marriage, low profile of the family, which leads to child marriages. Sometimes back, we have made a study, and we are bringing a classifications we made. What type of classifications we made through our close observation on the children. We never conduct a study exclusive on the child marriage. We identified that children attending the school as well as work, what we call child work. Children only attending the school, they are never attending the any kind of work. And that category we made it only child labor. The children never attending the school at all. And the fourth category is the children is neither in the school nor in the work. Even in many villages, we find 9 to 10% of the children are neither attending the school nor in the work. We can understand this is a reality. We are often talking about the child labor. We are often talking about the street children and all. But these certain kind of children are They are not available in the both side. They are not working. They are not working in the schools. So close looking, close observation, close making analysis. This is a way to make a meaningful analysis, and we can stop the stop the child marriage at the initial level, and we can bring many stakeholders together because everything is achievable. I have number of forums I have discussed because many people have received their degrees because of children are working. Many people have received the degrees because child marriage is being practiced in India. Many people did the research on various aspects of children in juvenile delinquency or children in conflict law. But what is the problem is, could we stop any of these issues at one particular juncture? Several acts have been made, several programs have been conducted, several policy making have been introduced. But the problem is still problems are, we are living with this problem. But want to make a clear cut, conscious conscience to stop this child marriage an issue. It is an issue because the title itself shows that child marriage, early marriage, forced marriage. But these things are, marriage is an institution context is concerned, because marriage is we can learn. The child is the bride is learning new kind of ideas to how to lead the family, because family is the only basic unit. When the members are very happy in the family, they can deliver their goods. And the family is, because family can help, the industry can increase the production, they can help the people, the personalities, and all the things are, family is very, very important. There is a things, the CH Cooley of USA saying that, who coined the term group, is saying that primary group is a seed bed of the society. Primary group consists of not only family members but the neighboring also. So child marriage is not only one aspect; it is joining together by wherever possibilities are there, child labor, wherever possibilities for there for the children in conflict with law, wherever possibilities for there is no protection for the children. Because we know very well where is the problem for the child protection? The closer family members, the members of the who knows the child very well, they are the problem creators for the child. So childhood is very important phase in human life journey. Several scholars have done a lot of research on Yagat, and many people have erection. A lot of people did the research on the thing because sociology emphasizes childhood is a learning the road. Learning the road in the sense, because every stage is child has to climb. Climbed. These things are to be emphasized, to be understood properly. So we can make a meaningful analysis by making close observation, by making the study by bottom to top approach instead of, so far we are top to bottom approach, because planning with the people is very, very important, not planning for the people. If you make a meaningful analysis, Indian children have a blossom, Indian children have a meaningful years in the days to come. So with these few words, I once again express my sincere and heartfelt thanks to Dr. Balu and others who have invited me to join this important meeting at this juncture. I once again express my sincere and heartfelt thanks for your patience listening to me. Thank you so much.
Thank Achalam for different dimensions on this child marriage. And you have covered your own experiences and academic experience related to this child marriage.
Yes.
Also have been appreciated about it. And there is one question: if you are promoting child protection committee in panchayat level, is it possible to prevent the child marriage?
Certainly, because our experience was that, because I was involved with the planning commission at the state level, planning commission at district level, and other stakeholders are joined together, we can prevent. Some of the villages where we have made a research, wherever possibilities are there for the migrations are taking place much. So there are possibilities for child labor. So we have given some way forward the things, these kind of committees. And when you are preventing the migration, because why they are going for a migration? Because there is no possibilities for job or income generation activities. So these things, I hope this is we can do at a certain level, we can prevent or we can stop it.
To add on that, as of my opinion, just promote alone cannot prevent the child marriage. This will hope definitely will reduce the number of marriages, or can be also address some of the issues related to child marriage. But we cannot say that promoting the child protection committee alone is not going to prevent the child marriage. That's what I personally feel.
First itself I told that because even I did research on 1990 on child labor, but still child labor is being practiced. But we need some kind of new novel approach, how to make it a meaningful at this juncture. At least we can reduce, because for the first itself I told that female infanticide somewhat now nil or completely reduced, we can say that. So this type of practices can advocacy, lot of practices we can make through experience, and I hope we can avoid the child labor in the years to
Mr. Dr. Tabas, would you like to add any points here? Yes, unmute.
First of all, I congratulate both the speakers for their wonderful presentation relating to the very important aspects of this child and forced marriage that is happening in our Indian society during this COVID pandemic. In his presentation, Mr. Sonukutti has very in a very beautiful way depicted the importance of factors responsible for child and forced marriages, and he also highlighted priority intervention of child protection in our society, and lastly he has highlighted the role of community-based organization, administration, and child and forced marriage in Indian society. And Professor C. Venkatachalam has highlighted the three important aspects of child marriages in Indian society, and he has highlighted the role of family and priority groups for child protection in Indian society. And he also highlighted the rights of child in Indian society, and in his presentation he also highlighted that in Indian context there are different schemes for prevention of child marriages in India, and lastly he highlighted the role of cultural traditions for the child and early marriages. So in this discussion, we have more or less understood the factors of the child marriages and early marriages, and that is also very important in the time of COVID-19. So the solutions highlighted by Dr. George Sonikutu is very much essential here. There is a role of family members, community groups, and well as the various outreach organizations like child lines and district administration should come forward to make a solution, practical solution for the problems. So I thank Mr. Sanukuti and Professor Venkatachalam for their wonderful presentation, and I hope that this discussion will be open the window for our scholars and policy makers to curb the social menace engendered by the COVID-19. Dr. Balu, it's over to you.
Yeah, thank you. There is only one question I would like to given to Mr. Sonikuti, sir. There are so many government schemes and social protection schemes and many agencies also working in the field. But still, why we are not able to reduce or stop the child marriages? Where is the problem? This was the question raised by one of the participants.
Yeah.
Devan.
No, I see. I think we need to look at social reforms through legislative processes in a very particular manner. We have really the Child Marriage Prohibition Act is 100 years old. And the social norm around child marriage is so strong. Like, for example, if you ask to define a loving, caring father or a loving, caring family for a girl child, everybody talks about marriage at the appropriate age as a first of such responsible parenthood. Now, this appropriate age is varying from community to community. In many places, it is 15, 16. In some places, it is 18. And in few places like Kerala, it's like, 20, 21, 22, or maybe more. But it's like, so the whole dimension of the social norm, whether it is seen as a good and loving thing to be done to my child, is the primary question. And that is precisely the reason behavior change and social norm change needs to be the key dimension of action. It is not going to be punishments that will actually stop such practices. And I think one suggestion or one observation which I had seen was the increasing rape cases actually increasing the number of child marriages, because parents want to be supporting or protecting their girl children. And I think these are much larger issues of gender, perceptions of gender, womanhood and manhood and things like that. And it requires a much larger debate. But for me, the most loving, caring thing is seen to be the marriage of the daughter. And therefore, like, the whole thing which gets centered around the social norm around child marriage becomes very critical. And that is precisely the reason why we are not able to deal with it. Now, you see, the more we try to deal with it with punishment, with, for example, with POCSO Act, we said up to 14 years imprisonment, life sentence, and this one, that one. What happens is, like, the side effect of it is, like, around 40% of the POCSO cases in India are elopement cases. Which is like, 17, 16, 17, and the whole pressure on the system is very different. So how do we really look at all this in a much more balanced manner, and how do we really see this in terms of universal education, making sure that children are in school up to 18 is the best way. I mean, either in school or in vocational training or whatever form of organized uh, allowing themselves to grow to their full potential is actually one of the key things. Unless we strengthen that system, the others will, like, if you have, like, we saw the quadrant, whether it is like no education, it's 40%. Child marriage, 47%, 50%. Actually, if you really look at Dr. Venkatachalam's present, that was like 98 data. 47, 50% child marriage. That holds good even now in certain segments. So this, I think, is the more important thing which I've noticed. Yeah, right, Dr. Balu.
Yeah. Thank you so much, sir, for promptly answering. There was one question related to some of the projects related to tracking project. As of now, NIDM is not having any projects on child marriage, but we have a project supported by UNICEF. It's a child-centric DRR project. That is the only running project right now. Maybe in future, the NIDM may think over of it. There is no any other questions related to this. So.
No, I think the question it was on fast tracking of cases on children. I think fast tracking justice, and I very strongly believe it's like, NIDM's responsibility. We need to really differentiate fast tracking of cases relating to children or cases relating to child abuse, and this one is more of a judicial and a state intervention. And there are newer codes and systems which are getting generated there. I think we really need to be clear that NIDM is actually also mandated to be tracking missing children, maybe separated children in emergencies, in COVID itself, like, what actually is happening. And that, yes, I think would certainly fall under the mandate of NIDM to be on the watch out to see if there are increase in this one. But I think fast tracking of cases and this one is like, this is not related to an emergency or a disaster. It is basically the response of the judicial system, how we respond to positions relating to children, I think. And that is something which is attaining a lot of interest in the last 1 decade. And there is a lot of, like, the Supreme Court has a committee on juvenile justice, which actually looks into POCSO and juvenile justice and offenses against children and offenses by children. How do we track it? How do we look at adequate number of courts? How do we look at increased infrastructure, things like that? Dr. Venkatachalam will also agree to that increase in that realm of activities in the last 1 decade or so. Yeah, thank you.
Thank you, sir. Definitely, I'll take your suggestions I'll take your points. There is one more suggestions are there. In parents teachers meeting in school, teachers can aware of parents for child early and forced marriage, not only for girls but for boys also. Yeah, we do agree with you. If there are no more questions, I think we can wind up the program. Tabas, I'll be wind up the program right now. Is there any points, sir, from your side? From both the speakers, would you like to add any other points?
No, sir. Please, we can go for vote of thanks.
Okay, Professor Venkatachalam, sir, would you like to add any other points?
No, sir. That Putty has pointed out that these things we have to look into this very carefully, and you are also raising the point. Parent teachers associations are there. That is a right point, and we have to look into these things. More number of studies from my point of view. Those observations, some more studies, we can find out what are the possible eliminate these child marriage in the year. There is no much points from me.
Yeah, thank you so much, sir. Finally, on behalf of National Institute of Disaster Management Child-Centric DRR Center, I would like to extend my sincere gratitude to our eminent speaker, Mr. Sonikuti Charge, a child protection specialist, UNICEF. And I also extend my sincere gratitude to Professor C. Venkatachalam, former professor and head Department of Sociology, Periyar University, for enlightening the participants with your knowledge and experience in the field of child marriage. I also extend my sincere thanks to the patrons, Major General Manoj Kumar Bindal, sir, Executive Director, National Institute of Disaster Management, and Dr. Edindra Singh, Professor and Director, MPI SSR Ujjain. And I also extend my sincere thanks to Professor Santosh Kumar and Dr. Kumar Raka for their guidance. And on behalf of CCDRA Center, I also thank MPI SSR, Madhya Pradesh Institute of Social Science and Research, the coordinator, Dr. Tabas Kumar, for making wonderful coordination with NIDM for organizing such a wonderful webinar. So finally, I also extend my gratitude to all the participants for participating in this program. So once again, I thank Mr. Sonikuti sir and Professor Venkatachalam for their valuable time. Thank you so much.
Thank you, Dr. Balu. Thank you, everybody.
Yeah, thank you, sir.
Thank you.
Thank you, Dr. Tabas Kumar.
Thank you.